Hello, my name is Fiona Brady and I'm the Education Specialist with Down Syndrome Ireland. I would like to welcome you to this presentation, which gives an overview of the dual diagnosis of Down syndrome and autism. This is one of a series of presentations on the topic. Given that autism is very common in children with intellectual disability, it should not be surprising that the proportion of children with Down syndrome screening positive for ASD can also be high. However, the expectation set by early medical textbooks is that Down syndrome actually reduces the risk of having an ASD. And the fact that Down syndrome is diagnosed very early in an infant's life might also play a part in the low rates of the dual diagnosis. Once the diagnosis of Down syndrome is made, it is often felt that there is no need for doctors to seek other explanations for why the child might not be following a typical developmental pattern. In other words, nobody is looking for any other conditions. However, if a child with Down syndrome also has an additional disorder, such as autism, this diagnosis can be very helpful in ensuring access to dedicated support throughout life. For many years, the possibility of the co-occurrence of autism and Down syndrome was considered to be very rare. However, over time, researchers began to take note of the possibility that some children with Down syndrome could also be challenged by an additional behaviour diagnosis, i.e., an Autism Spectrum Disorder or ASD. There is some information we need to know about autism spectrum disorders before we begin to comprehend what ASD might look like in a child with Down syndrome. ASD is a developmental disability identified by a developmental and behavioural evaluation process. There is no medical test for autism. Therefore, skilled and experienced personnel evaluating the child is extremely important. ASD involves disorders of the development of the nervous system, including the brain. ASD in a child may involve many of the child's biological systems, for example, their gastrointestinal system, their vision, their immunity, etc. The specific cause of ASD is not known, but scientists and researchers feel that the condition is strongly genetic. In addition, the biological aspects of ASD have not been found to exist in any one part of the brain. Alternatively, it's more likely to involve problems with the way the brain sends messages from one region to another. There is an increase in children with ASD throughout the developing world. And just to look at some figures to give us an idea, in 2005, one child in every 2,500 children was diagnosed with an ASD. Come forward to 2019, one child in every 161 children were diagnosed with an ASD. So that's quite a considerable increase. Autism spectrum disorder is reported to occur in children of all races, all ethnicities, and all socioeconomic groups. It occurs more often in males, with approximately 3 boys diagnosed with an ASD for every 1 girl. So that's a ratio of 3:1, boys to girls. And clinicians and researchers would say that the disorder has a lot of variations. There is also information we need to know about Down syndrome before we can begin to comprehend what an ASD might look like in a child with Down syndrome. The majority of cases of Down syndrome are caused by a failure in cell division. A child with Down syndrome will be born with 3 copies of chromosome 21 instead of 2. Down syndrome affects over 300 genes and affects multiple systems in our bodies. We associate Down syndrome with specific facial features and with a specific cognitive profile. And having a specific cognitive profile will lead the child with Down syndrome to having a very specific learning profile. In other words, they learn in very specific ways. Down syndrome also may predispose some children to specific behavioural issues. Now, it's important to note here that not all children with Down syndrome will have behavioural issues. Some is the important word. Down syndrome does not automatically have a behavioural implication. So before we come to any stage of making a dual diagnosis, we really need to have an understanding of ASD disorders separate from Down syndrome before we can even attempt to understand what a dual diagnosis of both would look like. So in summary then, autism is a spectrum disorder. It may be mild or severe. Many of the symptoms overlap with other conditions, such as an obsessive compulsive disorder, OCD, or an attention deficit hyperactivity disorder, ADHD. ASD is a developmental diagnosis, and an expression of the syndrome varies with a child's age and developmental level. Also note that autism can coexist with conditions such as intellectual disability, seizure disorders, or Down syndrome. And finally on this slide, similar to Down syndrome, autism is a lifelong condition. So the most commonly described areas of concern for children with an ASD include communication issues, using and understanding spoken words or signs, problems relating to their social skills, problems with the way they relate to people and in social circumstances, repetitive body movements or behaviour patterns. However, we should note that children with an ASD, they may or they may not have all of these characteristics at any one time. So some of the variable characteristics of ASD that we might commonly expect to see in children with Down syndrome and autism, they may have unusual response to certain sensations, especially to certain sounds, lights, touches, or pain. They may refuse food. Certain textures or tastes would be preferred. They may engage in unusual play with toys or other objects. They may exhibit difficulties when there are changes in their routines or when there are changes in their surroundings, when they go from familiar to unfamiliar surroundings. And very often, the children can engage in little or no meaningful communication with others. They can also display disruptive behaviours. They can be aggressive, throw tantrums, or be extremely non-compliant and stubborn. They can be very hyperactive with very short attention spans and be very impulsive in things that they do. They can also unfortunately engage with self-injurious behaviour, like picking at their skin or hitting their heads or banging their heads. They can poke eyes, either their own or someone else's, or they can bite. They can also display sleep disturbances, and they will have a history of developmental regression, especially in the areas of language and social skills. Children with a dual diagnosis of Down syndrome and autism, they are more likely to have congenital heart disease and gastrointestinal tract problems. They can suffer from seizures, a dysfunctional swallow. They can have severe hypotonia, and hypotonia is loose muscles or floppy muscles. And they can also have motor delay, and this will be delay in both their gross motor and their fine motor skills to a larger degree than we would expect to normally see in a child with Down syndrome only. They can also have ophthalmological problems with respiratory problems. They can suffer from pneumonia or develop pneumonia quite easily, and they can also have sleep apnea. So in general, they can have an increased total number of medical conditions. One thing that's critically important is that an autism spectrum disorder, if it's present in a child with Down syndrome, this needs to be recognised as early as possible. Because a dual diagnosis like this has implications for the child's education and life skill management, which will carry on not just through their school days, but right into their adult lives. And as in many other areas, there is some disagreement in the medical community regarding the specific evaluations that are necessary to identify a dual diagnosis, or indeed the degree to which certain core features must be present to establish a dual diagnosis of autism in a child with Down syndrome. And unfortunately, the lack of specific diagnostic tests does create considerable confusion for professionals, for parents, and for others trying to understand the child and develop an optimal medical care or effective educational programme. A variety of special diagnostic tools are needed, and these can include questionnaires, interviews, observation schedules, and all of these will be used alongside a medical diagnosis, a medical history taking, other history taking that may be useful, and clinical observations. And we need to note that none of these tools used in isolation can be used to establish a diagnosis of Down syndrome and autism. A specialist in the field will take the results from all of those tools, put them all together, and will then come to a diagnosis. If you suspect that your child with Down syndrome has some of the characteristics of an ASD, or indeed some other conditions that would qualify as a dual diagnosis, it is very important that your child is seen by someone with sufficient experience in evaluating children with cognitive impairment. And ideally, that would be somebody with expertise and experience in working with children with Down syndrome. We also need to remember that some of the same symptoms which can occur as part of the dual diagnosis of Down syndrome and autism, they're also seen when children with Down syndrome might be exposed to stressful or maybe chaotic events or environments. And let's just look at an example of this. Sometimes when a child with Down syndrome is experiencing a medical problem that might be hidden, for example, an earache, a headache, a toothache, and so on, the situation can result in that child demonstrating behaviours which would be considered autistic-like. They can go so far as to self-injure themselves, they can become extremely irritable, or they can demonstrate aggressive behaviours. So therefore, a comprehensive medical history and a physical examination of the child is essential and mandatory to rule out the possibility that there might be other reasons for the behaviour, as opposed to just deciding straight away it's a dual diagnosis of Down syndrome and autism. Parents also have a role to play in this. In addition to any medical assessments and other observations, they will be asked to help to complete a checklist to determine whether or not the child has ASD. Some samples of these checklists and some examples are the Autism Behaviour Checklist, the ABC, can be used. But there's also others, such as the Childhood Autism Rating Scale, the CARS, the Gilliam Autism Rating Scale, the GARS, is also a possibility. Each of these is completed either in an interview with the parents or done by the parents and completed before they come to the appointment. All of these tests are then scored and they're considered along with all of the preceding clinical observations and medical history to determine if the child has an ASD. And the most commonly used diagnostic tool by clinicians is the Autism Diagnostic Observation Schedule, or the ADOS. On this slide and the next slide, I have listed some resources that will be helpful for you. On this particular slide, I have a few websites, the Autism Society of America, and indeed the one on the bottom, the National Association for Dual Diagnosis. They both have a lot of very, very useful information. And on this slide, I have listed some books and some useful articles for you. The first book listed there, When Down Syndrome and Autism Intersect, is an extremely useful resource to have and to read, both for parents and teachers alike. This book, published in 2013, would be a very, very useful resource for you to have. As I said at the beginning, this is one of a series of 5 presentations that are now on the Down Syndrome Ireland website in relation to the diagnosis of Down syndrome and Autism Spectrum Disorder, the dual diagnosis. This is the first presentation in the series and it's an overview, as we've just heard. There is also a second overview, but this one is looking specifically at language aspects and behavioural aspects of a dual diagnosis of Down syndrome and Autism Spectrum Disorder. And then we have a threefold set of presentations, educational programmes for children with Down syndrome and Autism Spectrum Disorder. The first one gives an overview of the requirements in both the school and the classroom. Part 2 looks at inclusive best practices, building friendships and communication with peers, and positive behaviour planning. And the third one looks at the role of additional adults with specific focus on the SNA, developing IEPs, and planning for the transition from primary to post-primary school. On this slide, I have added our email addresses. The top one there is mine, Fidelma Brady, fidelma@downsyndrome.ie. I've also given you the email address from my colleague, Nicola Hart, who's the Head of Member Support in Down Syndrome Ireland. And I have also given you the website address for Down Syndrome Ireland, and this is where you will access all of the presentations I have just mentioned. They're all available and they're all free, and you can download them and keep them for future reference. And finally, I would like to acknowledge Dr. Warner, Professor Howland, Dr. Hebburn, Dr. Fiddler and Dr. Capone, all of whom have contributed to this presentation because it is their work and their research that has informed the slides you have just seen. I really hope you will be able to join us for the remaining 4 presentations, again available on the Down Syndrome Ireland website for free download. In the meantime, bye for now.